California is now facing a $12 billion deficit.
Governor Gavin Newsom made the announcement today as he revealed the revised state budget.
We have team coverage tonight on the governor's updated spending plan, including the possible impacts on immigrant health care.
But we do want to start with ABC 10's Jeannie Nguyen, who was at the announcement today. And Jeannie, you're talking to people on both sides of this issue.
Chris and Laura, this morning the governor announced a $322 billion budget with a $12 billion deficit. And as you recall from his January budget proposal, he expected the state by now would be in a budget surplus. Tonight, Republican lawmakers say that the state has a spending problem and that this will not help the state in the long run.
We were off. We were significantly off.
On Wednesday, Governor Gavin Newsom admitted the state was wrong when he initially predicted back in January the state would have a $363 million surplus in the state budget. Newsom is now blaming the Trump administration's actions for the lack of incoming revenue, calling it a, quote, Trump slump.
We're going to see an impact about a $16 billion downturn, not all in the next fiscal year, but fiscal year plus one.
Governor Newsom says the state is now facing an $11.9 billion deficit with a $321.9 billion budget and $15.7 billion in reserves. The governor's office wants to do several things, including using billions from the state's rainy day fund and even negotiating state workers' pay.
The intent is really to avoid increased costs in the upcoming fiscal year, and is not to implement furloughs or PLPs or those type of things.
The governor is also proposing changes to Medi-Cal.
$5 billion on a freeze on our Medi-Cal expansion. We're not cutting or rolling back those that are enrolled.
This would apply to those receiving Medi-Cal regardless of immigration status. The governor is proposing a $100 premium for undocumented immigrants, and the freeze would apply to new adult applicants older than 19.
We're just capping it, particularly for those without documentation.
In response, Republican lawmakers say the state cannot continue to provide Medi-Cal services to people without documentation.
We just simply can't afford it. And he's acknowledging that by this budget's adjustment. And in future budgets, I think we're going to see more.
Now, ABC 10 did ask the governor if there is room in the budget to put resources towards the voter-approved Prop 36. To hear his answer, that is coming up tonight on To The Point at 6:30. Live at the Capitol, Jeannie Nguyen, ABC 10.
Yeah, sounds good, Jeannie. Thank you. And again, this is just a proposed budget. The legislature will have to pass a balanced budget by June 15th.
And advocates for immigrants are fighting back against the governor's plan to freeze enrollment for state-funded health care for immigrants without legal status.
But there are lawmakers who say the program was flawed from the very start. ABC 10's Roxanne Elias explains both sides.
Immigrant advocates are outraged at Governor Gavin Newsom's newly proposed restrictions on the state's Medicaid program for undocumented Californians.
I was completely devastated to see this news, to see the state choosing to balance our budget on the backs of working people, hardworking immigrant communities.
Under Newsom's plan, low-income adults without legal status will no longer be eligible to apply for Medi-Cal, taking effect next year. Josh Stalick, the policy director for the California Immigrant Policy Center, says it feels as if the governor is abandoning a proud legacy of bringing California to a state of almost universal health care.
It will end up resulting in folks being unable to access health care that they vitally need, which means that they'll be living sicker, potentially missing work.
He says it could also lead to systemic problems affecting all Californians in terms of potentially overburdening emergency room systems and potentially leaving hospitals uncompensated for the care. Amanda McAllister-Wallner with Health Access California is also worried for the people who already have coverage and are 19 years and older. The governor has proposed they pay a $100 monthly premium.
People making under $15,000 a year, under $20,000 a year, where paying $100 a month just isn't possible.
Republican Senator Brian Jones says he warned the governor over a year and a half ago that the program was not sustainable.
What's happening now is the governor for the last 6 years has been making all of these promises of what he's going to do with Medi-Cal, without really analyzing and paying attention to the outcomes.
In total, Newsom's office estimates the changes will save the state $5.4 billion. But Senator Jones says it's too little and too late to avoid the damage.
If you take a look at the cuts that we're going to need to make this year, that's legal residents and citizens that are paying their taxes that are now going to have some kind of service cut.
Roxanne Elias, ABC 10.
Immigrant advocates are calling on lawmakers to oppose the cuts. They'll work with the governor's office to come to a final budget deal over the next month. And keep in mind, you can watch the governor's entire budget announcement on the ABC 10 Plus TV streaming app. The app is free to download on your TV.